Joining me now is Brendan Shaw, Chief Revenue Officer at ReadySet Surgical, and Jay McDonald. He's the Associate Vice President of Channels and Partnerships at Green Security, and really just looking at a lot of different topics around technology and integrations and partnerships. And, that really lends to today's conversation, which is how can we improve compliance and get that clarity or that transparency through connected technologies. And, a lot of times we think about technology and we think just simply about automation, but it's not just about automation. So I want to welcome you both. Brendan, welcome back. You've been on most of these episodes. So maybe again, just a quick introduction to you before we hand it over to Jay, so he can tell us about himself and his role.
Yep, Brendan Shaw, just newly moved into the CRO role here at ReadySet. Looking forward to this conversation. Come from a long background of sales management, and spent the last 2+ years here in our alliance role.
Excellent. And Jay, why don't you talk about your role with Green Security?
Yeah, absolutely. Thanks, Justin. So Jay McDonald, AVP of Channels and Partnerships here. Been in the vendor credentialing space for a little over 10 years, working with several other vendor credentialing organizations. Also spent a little bit of time working in the GPO space and specifically purchase services. So over the last decade, I've really had a great opportunity working with various organizations and how they integrate with each other to really improve efficiency in the supply chain space.
Well, it seems like every time I talk to a health system, they tell me that they're changing ERPs or they have an EHR that they're implementing. It's kind of the common refrain right now, and for obvious reasons, right, is connecting that data. But then there are lots of technologies out there that vendors interact with or that are bolt-on solutions or might integrate with an EHR or an EMR. And I think a big struggle right now is how do you take all that fragmented data that's trying to be connected and do something really strategic with it? And so, Brendan, maybe you can kind of kick us off here about, why are these integrations important and, what can we do with real-time visibility in terms of decision making?
It's a great question and observation, Justin, from that standpoint. What we see a lot of times is hospitals a lot of times are on the defense, especially in the area that we play in, which is more on the orthopedic side of it. Vendors show up on site. They have a whole bunch of equipment. No one knows what it's going to be used for, what case it's supporting. So, by having integrations into the EHRs, into the OEM vendors, as well as ERP, it really allows us to kind of bring that all together. We know what case, what surgeon the equipment's for. We know what OEM needs to be invited to that case. We know if it's on contract or off contract. So there's really a lot that goes into kind of that full connected ecosystem. And when you look at bringing in someone like Green Security, we're typically looking at just the equipment side of it. Now this takes us into a whole new ballgame. We're really validating everyone supporting a case.
Jay, I think that's a good segue for you is just, Green Security sits in a little bit different space with the providers and the suppliers, yet very similar to ReadySet, sitting in between the two and being a conduit for how vendors are working with the health systems. As you're kind of sitting in your role and looking at integrations and partnerships, what's kind of the vision for both sides of the table from your perspective?
Yeah, that's such a great question. From where I'm sitting right now, this is a gap that most health systems are challenged with. And where Green Security really has a good space is because we integrate with multiple partners, multiple EHRs, it allows the vendor to reduce some of that common friction that they see in the marketplace when they're going from health system to health system. So we're able to really kind of capitalize on those key requirements that vendors might be required to. So when we talk about partnering with ReadySet, right, they're going to capture one side of that scheduling side where they work, but we're really going to help understand the policies and what that vendor needs to do, whether it's training, whether it's any type of compliance document, and even how to interact with staff on site. So by our kind of integration together, we're able to really help that rep get into that case sooner and really address any needs that hospital may have.
Yeah, I think one of the exciting things that the two of you have described is just because you're integrated at ReadySet with ERP, you get demand signaling on case scheduling. And so if there is, a vendor that's not up to date or approved with the credentialing, that they know ahead of time. They're not finding out the day that they show up, or, a customer kind of pulled their attention off of making sure that they were approved at that facility. And there are some reminders in there, and that communication's happening ahead of time. But I think, Brendan, if you could talk a little bit about, how you're tying some of those fragmented data challenges just with ReadySet, and like what you're doing for the rep. And then we can kind of go a little bit deeper dive on the credentialing side, and then talk about the synergies. Cause I really do think that, the reps have all these different point solutions. How can they have more visibility to what they're supposed to be doing and what the hospital needs from them?
Yeah, that's a great point. I think when you take the view from the rep, they get a lot of different systems. We're not the only ones that play in this space, right? So one of the things that we've kind of prided ourselves on from an OEM relationship perspective is making sure that we integrate directly into their application. So they're using their native application where they keep all their cases, schedule their cases. So the first integration that we have really comes at the EHR side. So whether that's Epic, it's Cerner, it's Meditech, when they schedule that case, we get that advanced case notification, and we're able to send that directly through to the vendor themselves. So, the rep gets an advanced case notification. I got an upcoming case to support a certain surgeon with a certain type of patient, certain procedure. That advanced case notification can come out up to 40 days in advance. So when you look at and kind of couple that with what we're doing with you guys, we need to know that vendor that's coming in to support that case has the credentials he needs before that case starts. So if it's 40 days out, he has something that expires in the next 10 days, we're not able to catch that. So that's going back to kind of how we integrate. The EHR is the first touch point. The second touch point is really once they declare what they're bringing in to support that case. We have direct integrations from the OEM. They give us what they're bringing in to support that case, again, ahead of time, so that we can validate that it's on contract. It has an item master assigned to it, or it's on a contract itself, which really allows us to start circumventing a lot of that off-contract spend that comes through the hospital. So those are the major touch points we have: the EHR, the ERP, and then the contract database, which really help us align before the case even starts that we're getting the right patient care to that particular case.
Jay, the first thing I think about when Brendan's talking about being integrated with the EMR and the EHR is like how many of these SaaS solutions want access or need access. And so then what does that do for the hospital's bandwidth to set those up and get those and make sure that everybody's gone through the security requirements? I almost feel like by integrating two different solutions, there's obviously, to me, more benefit for ReadySet to own sort of the case scheduling and getting that to the rep and getting that tied over to the supply organization. But, in a silo, I would imagine if a health system wanted to know whether or not a rep had a scheduled appointment, they're probably doing it. The rep is probably scheduling that appointment in Green Security separately. And by integrating, you can kind of take all of that and make things easier on the vendor and give better transparency to the hospital. How do you see that all fitting with compliance?
Yeah, you're absolutely correct, Justin. I mean, today, this is a major, major challenge and frustration point, which just trickles into the health system and ultimately costs money, right? So if you think about this today, the challenge is, right, you have a scheduler who's trying to schedule the rep, who's trying to make sure the product's there and all the patient information is correct. But then they're trying to understand, well, how do they connect that to the rep? And without an integration, there's really multiple systems and just duplication of processes. So this integration here is really, really powerful, and it improves that, right? So if you're a hospital scheduler, right, you're able to verify that rep is compliant, understand the product, the training, all the safety and compliance requirements for that rep. The rep on the other side knows that, I've done all the pre-work that needs to be done so that I can come into that case and I can meet with that physician. Again, reducing friction, reducing that redundancy of process that they go through. And this right here really helps reduce costs at the end of the day through labor savings and just lack of duplication. And it's so critical to both sides of the organization.
Yeah, Jay, just to add to that too, I think, when you look at, kind of, not having the right credentials and they show up on site, what is that process, right? You talk about labor savings. Now everyone's chasing around, but I got a patient sitting there ready to, go through surgery and I don't have the right credentials. I can't support that case, even though the equipment's there on time. So, I really think there's a true benefit to matching those two up. So not only is the right equipment there at the right time to support that, but the rep is credentialed and ready to support that case as well.
You brought home such a great point, Brandon. Like one thing I deal with all the time is, was the tray or, equipment there on time prior to going to SPD? And what we hear half the time is, well, it was an hour late. Well, why? Because the scheduling system wasn't integrated. We weren't talking to each other. So by going back through and connecting this, now all of a sudden SPD is able to stay on schedule. And now that patient case is not delayed, which is obviously helping the hospital continue to move through cases, which again is all boiling down to how are we becoming more efficient through technologies and integration, ultimately impacting patient care. And so while people can sit and say, well, hey, he was just missing this document, there are a lot of downstream effects that one document really impacts the business. And so this integration or integrating with various partners is critical to ultimately patient care and hospital revenue.
So forgive me if you've heard this one before, but bad data in, bad data out.
Absolutely.
It's almost like a joke now, right? But it's becoming more and more important because that's the whole point, bringing all the SaaS solutions to the table. It's like, let's get that visibility. The integrations now allow for the flow of that information to move much more smoothly. How does that impact data accuracy and access to information? I'm assuming what I think about with all these different point solutions is I think about somebody in supply chain who's an analyst and they're exporting in Excel from 3 or 4 different point solutions and then using VLOOKUP or Power BI to try to make that data sort of connect and tell them the story that they really want. I feel like, that's kind of not really what we're all trying to go for when we bring in these SaaS solutions. And so can you talk, maybe Brendan, you start this one too. It's just like how does this enable data accuracy, better insights, and overall just an understanding of how to access that data in multiple different areas and how they're connected?
Yeah, I can give you a couple examples. We run an analytics platform on our side through Power BI that really allows us to collect a lot of that information. What trays are coming in? Are they coming in on time? The same on the billing side of it, which is a billing process, right? Are we billing on time? All of those have ROI efforts from that standpoint. But what a lot of people do is use our data for a downstream effect, really looking at not only what your savings are, because that's all documented in our ROI savings, but looking at how do I better improve my vendor relationships, right? I know that Jimmy always comes in from Stryker and he's late 40% of the time. So in my QBR, I'm going to really work through, because we have the data now, we know that he's delivering late and what trays he's delivering late. The same thing goes for inventory. If I'm bringing in these off-contract items or bill-only items, they're not typically on your item master. So now we have the data to basically look and compare. You're bringing these in, maybe move it to consignment, or you're using it so much that you should probably end up buying that equipment to support those cases. So there's really a real savings there from an operational perspective. And then it also goes back to case costs, because we're pulling in all this information from these disparate systems, from your ERP, your EMR, your EHR. We're able to gather information and bring it down to a case cost, so we can know how you're performing knee surgeries across your entire IDN by surgeon. So, maybe we look at, changing things from a pref card. This doctor uses Zimmer, this one uses Stryker. How do we look and use the data to be more effective internally?
Jay, what are your thoughts on that in terms of, just data accuracy and the importance of, being able to access that quickly?
Yeah, it's so critical. So we've done a really good job historically of being able to identify vendor specific information, right? We understand Joe Smith and his specific credentials, but where the challenge has been in the industry is truly connecting that with the case. And so that's why this integration is so critical, is we're no longer reliant on the vendor rep to have that information. We're actually getting that in partnership with our partners. And so that information allows us to develop reporting that is very specific to the OEMs, to the physicians, to the healthcare system. And as they're looking at their spend and who's coming into their hospital and who's on contract or off contract, it's really given us that fidelity of the data to know exactly what's happening at a 50,000 foot. And so this data is what is empowering health systems to start to understand where there are gaps or product leakage within their organization. It might not just be one doc, it might be a series of docs. And so the data accuracy is actually providing those insights to the health system across the multiple facilities.
How important is this real-time visibility? I mean, just as decision making. Yeah.
Yeah, you need to have real-time visibility on everything, right? Especially when it comes to patient care or cases. If they change OR last minute, and the rep is at another hospital 2 blocks away, that becomes an issue. So I think the real-time aspect of things is definitely changing and extremely important as you start moving forward.
Yeah, and to that point, Brendan, right, when you're talking about compliance and credentialing, you start talking about immunizations, right? You got to think about the patient first, right? You don't want a kid who's dealing with a terminal illness and having someone who lacks the proper credentials. So truly understanding who that third person is in that case, understanding that they have the proper credentials, the proper immunizations, and that they're safe to be there is the ultimate goal. And so, yeah, real-time data is absolutely critical to these integrations.
Another thing, Justin, that I think is kind of important as we start looking at this, and especially with this integration, we're in certain regions, right? Take a central region. We're in hospital after hospital, as you are. So the reps are familiar with our system, they're familiar with your system. So as we start bridging this gap, a lot of people are going to come to only having one solution to use, and I think that's really going to be beneficial, especially as we start growing and expanding regionally.
Regional density really is important. I mean, when you think about just the reps having less solutions to deal with, I mean, that's really what I feel like if you're looking at this from the reps perspective, they want consolidation.
Yes.
And so, that regional density is something that I think comes up quite often is, hey, where are you in our market? Because we'd like to use what so-and-so health system or so-and-so hospital is using, especially if they're happy, and provide us a reference, right? I mean, that's kind of how things go.
Exactly.
When you look at partnering together, like maybe take some of the themes that we've been talking about, and we teed it up a little bit at the beginning, but as we're kind of bringing this home, what can you do better together that's more difficult when you're not integrated?
Yeah, I think I could start, Jay, and you could jump in. I think the big thing is really looking at this, and I think Jay mentioned it, right? As a whole, typically you have siloed, different things. Some people in the supply chain are looking at us. You have credentialing that may sit in supply chain, may sit somewhere else. Bringing that all together so you have one team looking at that, and more importantly, how that affects patient care, right? It's the OR ultimately that's responsible for what we're looking at because they're going in and doing the particular surgery that needs the credentialed person as well as the equipment there on site. So, I think that's a big component of it. And when you look at, kind of putting in those levels of defense from that standpoint, are they credentialed? And we know that up front. Are they credentialed when that case starts? And then finally, are they credentialed up until the case time? So I think that's a big component of it. And the automation, right? Being able to schedule, you guys have a different scheduling system than we do and work with the hospital. So can we automate that so it goes through? If they do have additional credentials that they need to comply with before that case, make sure that that's linked over to send to you guys as well. So when you look at kind of that integration, which we're kind of in the middle of right now, we haven't rolled it all out completely. I think there's some huge benefit to the overall systems.
Yeah, I'll jump in there too, Brendan. So I think of this from the supplier side, right? If I'm the vendor, right, I want to know that I can come in and do my tasks. And because there's multiple systems out there that we touched on, they don't always know what they need. And so when we're able to integrate and understand what the requirements are multiple days in advance, you're reducing that friction that rep is doing, right? We understand they're doing multiple cases per week. They're driving between hospitals. Sometimes they're flying across the country for a case, and they don't always have time. So when we can alert them, we're taking their temperature down to say, listen, this is really about patient care. Let's make sure we get the administrative stuff out of the way. And our integration allows that to happen, right? We can notify both the system and the supplier. These are the requirements. You're clear. You know what? Hop on that flight, get in that car, be on time for that case. And we all know everybody wins. And so like, that's really the way we want to think about this is how are we helping both sides of the table, right? Like, is this frictionless or minimizing friction for the rep? Is this reducing the risk, the compliance risk that the health system has of maybe we don't know this rep or this is a new procedure? And so the integration is really key to understanding how are we reducing risk? How are we making this easier on everybody who's involved in this case? And that's really where this integration leads us to.
That's a great point, Jay. I think that the vendor side of it is huge. The OEMs are kind of, the ones that need it the most.
Yeah, there are some real obvious operational efficiencies there, but I also kind of think about it in terms of just being mission ready, right? Like if you think about like before a pilot flies a plane, there's a checklist, and even as you go into the OR, I mean, having been a nurse, there's a checklist and you're going through like, are we ready to go? But there are a lot of other things that are part of mission ready that aren't necessarily like the scrub nurse's responsibility to check off on the list before the case starts. And a lot of that, big focus is case delays and being, how many are on time starts. And that's a huge metric. And the OR minute is costly. And so everything that you can do preparation wise leading up to essentially the mission to be mission ready is, I think financially, those operational efficiencies and that improved coordination and collaboration is going to have a big, and either one of you can speak to this, but I think it's going to have a big impact ultimately on, the financial performance of a health system and also the vendor. Honestly, like, if they were to know, that a case is canceled well in advance, I mean, just the logistics impact is also very positive. So like, we're all trying to figure out how to cut costs in healthcare. I think this is kind of uncharted territory when you're talking about vendor-facing solutions.
Yeah, I would agree. I mean, we're hearing more and more in our conversations that, OR time is king, right? So, how do we turn more cases? How do we, schedule better in the OR? So I think combining these is a big component of that. We can make sure the equipment's there, but we don't always know that the rep is there. And by having that advanced case notification and that continual update to the reps, really helps us. We have example after example with hospitals where, a rep showing up and the case was canceled 2 days ago, which is a waste of time on their side, right? So again, I think these combined are really going to kind of game changer for us.
Like I think about this also as we compare and contrast like other industries and other technologies that are out there. And as we try and adopt them, right? So if we think about an example like an Uber or a Lyft, right? So when you're scheduling a ride, right? And all the integrations that happen behind the scenes, we're trying to achieve something similar for a case, right? So is the location correct? What is the time of pickup? Who is going to be there, right? So if you're thinking about that app technology, how it makes it easier for the writer or in our case, someone in the OR space, right? It's where am I going? Who am I seeing, right? What is the destination? What is the time? And so these little bits of data and how we integrate is really become the standard, right? So if you're thinking about where is this industry going, it's not going away from integrations. It's actually leaning into integrations and how can we get better? How can we get more efficient? How can we really make it more beneficial to the patient at the end of the day? And that's ultimately what we're doing with these integrations.
Well, this has been an awesome conversation, and I really want to commend both of you and your organizations for, finding ways to just make healthcare delivery smoother for everybody that has to take part in that and being willing to work together on that. I'm going to lead to some final thoughts here as we're kind of wrapping up. But Jay, why don't we start with you? Anything you want to add before we wrap up?
I just want to add, thank you so much, Brandon and the ReadySet team. This has been a very insightful journey so far. Looking forward to the opportunities to come and how we can actually learn from ReadySet, but also from the supplier companies and more importantly, our health systems, right? We're not here to say we have all the answers, but what we are here to say is we're here to learn and get better one day at a time, and we're committed to the process.
Great. Thanks, Jay. And likewise, thanks to you and your team. It's been fun. It's a new space for us, right? I mean, we're mostly on the equipment side of it, but now bringing people into that, it's really kind of completing that ecosystem. And I think for us, we're excited about where this takes us, what additional ROI we can drive for our IDNs. So looking forward to the journey, and we'll look to where we go next.
All right, gentlemen, thanks so much for joining me today. And we got a couple more episodes still to come in this series, so make sure you're tuning in for those. And Jay, Brendan, thanks so much for coming on.
Thank you.
Thanks, Justin.
All right, that was Jay McDonald, Associate Vice President, Channels and Partnerships at Green Security, and Brendan Shaw, Chief Revenue Officer at ReadySet Surgical. And what I loved about this conversation today is really just partnering not only with health systems, but suppliers partnering together and bringing data, transparency, operational efficiencies. And one of the things that I think succinctly wraps up what would be really cool about an integration between Green Security and ReadySet Surgical is now you know the people that are coming in, the products that have been introduced to the organization, and the actual product that's coming in that day. There's a lot of visibility there. I think the demand signals on scheduling and giving vendors fewer different solutions to interface with as they support healthcare is so critical. So this episode, Compliance and Clarity Through Connected Technology with Jay McDonald and Brendan Shaw, absolutely excellent. Stay tuned here on Power Supply for the final 2 episodes of this ReadySet podcast series.